Hi friends, so with the next exam upcoming, it is very important that we change our pattern of study. So this is one of the videos which is showing you a very common chart that you must have come across or would be coming across in your operation theaters, which is your surgical safety checklist. Now, what is the surgical safety checklist? Now, this basically is actually a conglomeration of three components which are seen and done and checked to ensure the proper conduct of OT in an operation theater. So let's take a look at the detailed explanation of surgical safety checklist because we might be getting some of the MCQs framed from this particular topic. So if you see over here, the surgical safety checklist, it includes here before induction of anesthesia. Now this particular part, which is your before induction of anesthesia, is also known as your sign in. Now this sign in is done with at least nurse and your anesthetist. Now what is done over here? The patient needs to confirm his or her identity, the site, the procedure, and the consent. So the following things are checked: if the patient has, if we have taken the correct patient on the table, the correct site, the correct procedure, and if the consent is in order. Then, is the site where the patient is going to be operated marked or not? Then, is the anesthesis machine and the medication check complete? Then we have your, is the pulse oximeter on the patient and functioning, right? Then if the patient has any known allergy or any difficult airway or aspiration risk or risk of more than 500 ml blood loss or 7 ml per kg in case of children, right? So these are your components of your sign in. The first MCQs that can actually be framed over here is which of the following is or are not the component of sign in. Now the next is your before skin incision. Now this is also known as your time out. Now over here, all team members confirm that they have introduced themselves by name and the role that they are going to play, right? Then they confirm the patient's name, procedure, and where the incision will be made. Then, has the antibiotic prophylaxis been given within the last 60 minutes? Now, this itself forms another important MCQ regarding your antibiotic prophylaxis, which needs to be given within your last 60 minutes. Then, regarding your anticipated critical events. So, the various anticipated critical events, like to the surgeon, what are your critical and the non routine steps? How long would the case take? And what is the anticipated blood loss? Then to the anesthetist. Now, if there are any patient specific concerns, if the patient would be having any comorbidity, right? And then to the nursing team, if the sterility of the instruments have been confirmed, and if there are any equipment issues or any concerns, and for any case specific, if there is required for the display of the essential imaging, it is displayed or not. So these are your components that are checked in your time out component, which is your before skin incision. Now before the patient leaves the operating room, this is with the nurse, anesthetist, and the surgeon. So we hear the nurse verbally confirm the name of the procedure, the completion of instrument, sponge, and the needle counts. Now the specimen labeling, that is read specimen labels allowed including the patient name, and if there are any equipment problems to be addressed. And to the surgeon, anesthetist, and the nurse, what are the key concerns for recovery and management of this patient, right? Now this is also known as your sign out. So these are your components of your sign out, that is before the patient leaves the operating room. Now from this surgical safety checklist which you will be coming across in your operation theaters is actually a plethora of questions can be framed from here. Now first question that can be framed is which of the following is not a component of surgical safety checklist? Sign in, sign out, time in, time out. So the answer would be time in. Then the next question that is framed is regarding over here. So The equipment problems to be addressed is a component of which part? It is sign out or time out. So the answer is sign out. So please remember, so if there are equipment issues or concern, the question of equipment issues or concerns are need to be addressed in your time out, whereas the equipment problems need to be addressed in case of your sign out, right? So these are your few important points that you need to remember for your surgical safety checklist. And as you go around your OTs, make sure that you keep reading your surgical safety checklist, because this itself is a very important MCQ and has the potential to be asked in your upcoming next exams. Thank you.